Good afternoon, it might even be evening in some parts of the country that will be viewing this video, whether you're viewing it today, which is Tuesday, March 26th, or whether you're actually viewing it at some later date and some later time. We do want to actually, us here at the C.H.L.M.S Medi-Helpz Foundation, we want to tell you thank you so much. If this is your first time, thank you for stopping in to view, the videos that we put on. Once again, as I've always stated, if there's ever any topic that you would like to have a video on, and you're like, well, you know what, I know C.H.L.M.S does those videos, or they did that video. Let me see if I can get a copy of the video so that I can share it. Please outreach us. We'd love to share our videos with you. Right now, there is no cost to sharing the videos with you because it's all about getting the word out. We have so many patients throughout the world, not just here in the United States, but throughout the world, who suffer, needlessly suffer. And one of those groups of people who suffer and who C.H.L.M.S works very closely with is the women. It is Women's International History Month. It started March 1st. Some people have decided that, well, it's only one day. It's March 8th. Why are they doing the whole month? Well, the United States recognizes the history of the women and what we've each given back in our respective fields. And so it was like, let's give them a month. I mean, technically, if you ask me, we deserve a whole year, but who
I
actually has
agree.
a whole year dedicated to them, right? But there are countries, there's 29 countries that do something for women. And actually, I'm very proud to announce that there are 2 countries who actually make Women's International History Month a legal holiday. They actually recognize them that much that they give them a legal holiday. So what does that mean? That means, well, they could take the day off and get paid for it in honor of women, in honor of themselves. And for those 2 countries, I say could do, but maybe we'll follow behind sooner or later. But if not, we still can't stop being concerned about women. We still can't stop telling women that they are important and that what they have to share with the world and how their health is being handled, especially now, how their health is being handled is important, not just to them, to the women themselves, but to a community, to a society, to their family and friends. And so each day, well, not each day this month, because we're doing we did 17. We're doing 17. We got a few more to go, but we've taken the time to actually recognize those women who have stepped forward in the field of health, who talk about what happened to us in the past, who bring it to us and tell us what's happening to us now. And then they take an additional step and they tell us what it will be like for our future if we don't seriously take control of our health, which is called proactively taking care of our health now. What does the history for women look like in the future if we just stop caring and we just don't do what we're supposed to do? So today we are honored to have Dr. Kafilat Salawu. And if I said your name wrong, Dr. Kafilat, I am sorry. Blame it on the heart, not blame it on the head, not the heart, right? She is a board certified patient. She is a doctoral nurse practitioner and founder of Fides Health Advocates, LLC. Her experience as a patient, caregiver, community educator, advocate, and expertise as a family and hematology-oncology nurse practitioner have motivated her work as an extraordinary independent health advocate. Dr. Salawu has witnessed how poor communications, suboptimal medical team coordination, lack of patient understanding, and other healthcare navigational issues lead to medical errors and has led to medical errors involving her family, her friends, and her patients in the clinical setting. So without further ado, I'm going to go ahead and this turn this event and then turn this video over to Dr. Salawu. If you're watching on LinkedIn and you have a question, please, or a comment, please put your comments in the chat. If we do not get a chance to answer them before the video event ends, I will make sure Dr. Salawu sees those comments or questions that you may have, and she will actually respond to those comments. If it's a comment from me, I will actually respond to them as well, as long as they're positive. Because if I get any negative comments, you can send them. I can't stop you, but the chances are you won't get a response from me because I don't stoop that low to be doing work that that we all need and respond to negativity. It's just not me. So you can put them, and I would dare not send them over to Dr. Salawu because she's giving them her time freely, and she's not charging you for her time. None of my medical experts that I've had, whether it was Black History Month or Women's International History Month, have put a price tag on the information, the invaluable information that they've actually come forth to share. So by all means, I'm looking for positivity. Negativity just does not work with me. I will not respond. And that's not being egotistical, it's being truthful. So if you're on LinkedIn and you have a comment, please put them in your comment section. If you're on Facebook, please DM me or send me a message. Say, hey, Sandra, I heard this information. How can I get more information, or how can I get in touch with the doctor so that I can make sure that you're actually able to reach her? So without further ado, I'm going to go ahead and let Dr. Salawu take over this conversation.
Thank you so much. Thank you for the invitation. Thank you for allowing me to be on your platform, sharing information and helping our community. And not just our community, it's our, our society, our, people globally, really. So I'm grateful and I'm honored to be a part of this. I'm trying to share my slides, but it's not letting me. Oh, there we go. I can't hear you though. You're muted, but I got it now.
No, I had to add it. I'm sorry. I had to actually add it to the stage and I didn't. So that's why it wasn't up there, but you're good now.
Gotcha. Thank you. I hope everyone is doing well today. It's Tuesday. I hope your week has started off in an amazing way. Like Ms. Sandra said, I am Dr. Kafilat. I'm a doctoral nurse practitioner. And today we will be talking about women's health and how to navigate chronic disease and its management. A little bit about women's health. What is it anyway? I know she just talked a little bit about what women's health is and how important it is. It is and just like she said, it's a critical component of public health of our life, and not just the life of women really, but also the health of families, communities, and our societies at large. And why does it matter, right? Why does women's health awareness or advocacy, why does it matter? For one, it promotes health equity, enhances quality of life, and reduces the disease burden on individuals in our society at large. It also empowers us as women to take control of our health, right? And advocate for policies, in the White House, on a global scale or global level, even. A little bit about me. I am the founder and CEO of Fides Health Advocates, where, excuse me, I serve as a liaison between patients and their patients who have chronic illnesses such as cancer, diabetes, hypertension, and their healthcare professionals. I do the doctor in front of my name comes from being a nurse practitioner. I do have a doctorate degree in nursing, and I'm gonna kind of skip over. I'm not gonna bore you guys with the rest of my accomplishments and
Dr. I'm sorry. I
sure.
do actually want you to take the time, because this is International Women's History Month, and
Yeah.
each of us have a history that we acknowledge, right? But we also want others to acknowledge exactly what what your history was. I mean, it's important to you, but it's
Absolutely, absolutely.
equally important to us to know that we have this level of magnitude of talent within our community. One, as a woman, and two, as an African American
Yeah.
woman. So if you will please go ahead and go. You don't have to spend a lot of time, but if you can please go ahead and tell us exactly what your history, your timeline, right, has been.
By
I
all means.
appreciate it.
Absolutely, absolutely. So I'm originally from Nigeria, born and bred. I migrated to the United States with my parents about 20 years ago. However, my journey as a nurse, then as a nurse practitioner, started from my own family experience. Poor experience with medical care and medical navigation, which eventually led to the death of my brother, unfortunately. But then also, fast forward later on in life, something similar happened again, but thankfully no death was involved at this time. But that's pretty much what informed my advocacy platform and my advocacy work, whether as a nurse or as a nurse practitioner, or even at Fides Health Advocates, right? Currently, I am, even though my business, Fides Health Advocates, is located here in the United States, we're not only serving clients within the state of Georgia, it's nationwide, and we are also making global impact. I am a member of the Fides division of World Health Organization, and what I do with that, alongside my colleagues, it's about a little bit over 260 healthcare professionals all over the world. I have colleagues and team members from Australia, from England. Gosh, they're amazing, amazing group of people. I'm honored to be a part of them. And what we do is we educate people globally on chronic diseases, on communicable diseases, non-communicable diseases, whatever it might be. And we try to change the narrative as far as making sure that the information that is available on the internet, on social media, are correct, right? Because there's a lot of things that comes with when you Google your diagnosis, right? Or when you're on TikTok or when you're on Instagram. So our job is to make sure that whatever people are posting, the information people are offering to the general public are correct information. They're valid. They're based on evidence and not just people talking out of their head. I am also a committee member at Oncology Nursing Certification Corporation, where I serve to empower oncology nurses to improve the care that they provide to people and their families who have been impacted by the unfortunate diagnosis of cancer, whichever. It's not limited to any particular cancer. It's just oncologic diagnosis all through the spectrum. Now, my passion and my purpose is advocacy, wherever that might be, within the community, in the hospital, really at any length. And again, not just limited to the United States. I am doing that on a global scale, which I'm very honored and very proud, if I have to say so myself. And that's my website. You can follow me on Instagram. My Instagram page, we have lots of information on how you can improve your well-being, you can improve your wellness, and I'll share that too at the end of the presentation. So really the goal of the presentation today is to raise awareness, right, about chronic health conditions that are disproportionately affecting women. Examples of those are autoimmune disease, and that ranges from rheumatoid arthritis, type 1 diabetes, lupus, right? There's a whole bunch of them. Cardiovascular disease. When we talk about cardiovascular disease, we're talking about heart disease, arterial disease, stroke, heart attack, even anemia. Can increase the risk of women having cardiovascular disease. We're going to dive a little bit more into that in just a little bit. Osteoporosis is another one. Ultimately, I want us to collaboratively advocate for early detection, prevention, and adequate management of chronic conditions, not just for women, but really, since this is Women History Month, we're going to focus a little bit more on women during this presentation. So, objectively, this is what I am hoping that you guys can take away from what we're talking about today. For one, I want you to understand the prevalence and the impact of chronic diseases on women's health. And remember, we talked about these are not just issues that affect the women who are diagnosed with those conditions. It's a global issue, it's a societal issue when we're not focusing on women's health, or when we're not empowering women or advocating for women's health. I also want you to understand and explore the key chronic diseases disproportionately affecting women. We're going to focus really on 3 of them today, as I mentioned earlier. Also, we're going to talk about the strategies for effective chronic disease management tailored to women's need, and identify opportunities for collaboration and advocacy to improve women's health outcomes. Again, this is not just about me. It's not just about me, Sandra. It's all of us. We all have to contribute. We all have to chip in. You might think that, okay, well, I'm not a healthcare professional. Yeah, true, but you do have family members that you can encourage to make sure that they go for their preventive care, right? You have, even for you, right? You need to be on top of your game, and we'll talk some more about that too in a little bit. So starting off with autoimmune diseases in women, unfortunately, it affects more women than men. And there are different research that talks about potentially what could be causing this, right? Genetic variations, hormonal changes. We've been blessed with a lot of hormone for sure. As women, and as we age too, different changes, different levels. It kind of, sometimes estrogen is a lot more, it's less, it's at other times. So all of these take a toll on the body. Symptoms of autoimmune disease could include fatigue, joint pain and swelling, skin problems, abdominal pain or digestive issues, recurring fever, swollen glands. And these are not just the symptoms that can happen. In fact, people can have vague symptoms and not being able to really identify what's going on with them. But this is where your routine appointments, annual physical, this is where it comes in to kind of help you identify if there's any issue ahead of time. Next, let's talk about cardiovascular disease in women. Can you believe 60 million women? And this is just the United States. Think about what's going on in other parts of the world. 44% of women have some form of heart disease here in the United States. I don't know about you, but that's massive. And when we're talking about like heart disease, we're talking about hypertension. We're talking about, even diabetes could eventually lead to cardiovascular issues, right? Arterial problems, venous insufficiency, venous problems. And why is this happening? We don't fully understand it. However, some of the things that could be contributing to this is women's health. Our heart and blood vessels, right? Our blood vessels are smaller. The muscle, the wall around our heart is thinner. And again, here comes the hormone. The hormonal changes definitely does not help. Osteoporosis. I don't know how many of you have had your bone density test. We don't get it when we're younger, but the older we become, then that conversation starts to come up. And we tend to kind of slack on this, or maybe sleep on it, I should say, on osteoporosis, especially in women, because we always attribute it to, oh, that's the disease of the elderly. True. However, prevention of osteoporosis starts a lot earlier in our years, right? You can't try to, it's a lifestyle situation, and it's something that if you are at increased risk, and this is not necessarily for Black people. Honestly, it's, You could be white. You can be from any ethnic or racial background. And you could potentially have increased risk of developing osteoporosis, especially women or people who are taking high dose of steroids on a chronic level. For example, somebody who with autoimmune disease, take a lot of them take steroids often, so that could potentially lead to osteoporosis eventually. Um, but again, no matter your age, you can take steps to build your bone mass and prevent bone loss. And what are some ways to do that? Calcium intake. I would encourage you, though, to talk to your healthcare professionals to discuss, like, one-on-one, really, what's personalized way of preventing osteoporosis later on in life. When I say later on in life, I'm not talking about wait until you're 60, wait until you're 50 to start the conversation. Even with the other conditions that we've talked about, the cardiovascular health, right? You can't wait until you actually get a diagnosis of hypertension before you start caring about your heart. You can't wait until you reach the age of 40 or 50 before you start trying to care about your body or taking care of your health. I know people say life starts at 40. Not really. It starts a lot earlier than that. So you got to take care of your body before you actually hit 40 or 50. So early detection, prevention, and management. Again, regular medical and dental checkups. Very, very important, especially if you have medical history or family history of chronic issues, chronic conditions, right? Also depending on where are you living. Is there a lot of air pollution where you live? Especially here in the U.S., there's a lot going on here. God help us. Uh, Weather changes, the sunlight. Do you smoke? You drink a lot of alcohol. You gotta know, lifestyle modifications. Again, don't wait until you're older or until it's too. I mean, sometimes we say it's never too late, but that first cigarette that you smoke, it could make a huge impact in your life. Even staying next to somebody who smokes, right? You drink it. The World Health Organization put out information about vaping the other day. Vaping can lead to seizure within the first 24 hours of you using it. So you have to be careful. I know it's a social way of or it's a way of being social these days, but you have to be careful what your choices are, what you're choosing to do in your spare time or even anytime. Again, take care of your environment. What are you eating? Are you eating healthy? Do you know how much protein you're supposed to have in a day? Are you aware of how much liquids, hydration you're supposed to have in a 24-hour period to make sure your kidneys, your organs are functioning properly? Are you one who likes to detox a lot? What are you doing to detox? Are you doing it the right way? What are you doing? Are you being open to your provider so they know how best to take care of you? Avoiding excessive alcohol intake. Not drinking alcohol is best, but if you choose to drink alcohol, I want to share with you that the recommendation for women is to have one or less glass a day. When we're talking about glass, I'm not saying go get like one of those big, big jar. We're talking about regular size glass. But again, I do want to emphasize that not drinking at all is the ultimate, is the best way to go. But if you do choose to do it, make sure you know what the healthy limits is for your gender. Exercising. The recommendation is to exercise for at least 150 minutes of vigorous activity per week. Now you can spread that out 30 minutes per day, 5 days a week. You can do it however way you want. Uh, and going back to your family history, know your family history. I know sometimes people would say, well, Dr. Salawu, I was adopted. I don't know what my family history is. Well, you know what your ethnic history is. If you are Black, or you grow up in a certain condition. You grew up next to in a poverty reading area. What are some conditions that is common in your area? What's your socioeconomic status? It's not only about race. It's not only about our ethnicity. You know, are you rich or are you poor? If you're a rich black person, you're not on the same level with a poor black person. So those are the things that you have to put or take into consideration. And of course, this is a way to contact me. The QR code is for my website. And again, on our Instagram page or Facebook page, we have a lot of information, free information about how to stay healthy, how to understanding different chronic illnesses. Do you have any question for me? I know I've run my mouth a lot.
Sorry about that. I actually had to take myself off of mute. I'm not seeing any comments come in from the audience and from those who are listening. Once again, if you do, once we close in a few moments, if you do have a question or you have a comment or you just like to know more information about Fides Health Advocates, right? Perhaps because this is a collaborative group. The Fides group is a collaborative group. Perhaps you're a healthcare professional and you're looking for a way that you can get involved. You're
Yeah.
looking for a way to grow your own advocacy, or
Mhm.
you have something that you want to share. This would be an excellent point for to take our information down, or contact me or put it in comments. Once again, as she stated, what she's doing is not confined to the United States. So maybe you are an advocate, or maybe you are a healthcare professional
Yeah.
in a global community, and you're like, I really want to give back, but I just don't know how.
Mhm.
Beginning these conversations starts a long line of your on your own timeline. It allows you to see what else is out there. It allows you to know, okay, well, this is something that I can do, and take it and use it to your best advantage. We need to have organizations such as Fides. We need for people to come on board and say, hey, I want to help. Can you give me the information so that I can help? We
Yeah.
need this information. And none of us, I mean, when I look and I do the video series with the senior subject matter experts that I have appear on a platform, I always walk away with something new. And Dr.
Mhm.
Kafilat, today, I didn't know that Fides was a part of a global network. I didn't know that is one that's actually based throughout the world, not
Yeah.
just the country, but throughout the world. That's important to me because I often get asked, Sandra, where can I go? I see you doing advocacy. I want to do it. Not they don't really have anything in mind for what exactly it is they want to do.
Mhm.
I try to think of things and try to help them as much as I can.
Yeah.
But now I have Fides because now
Yes.
I can just say, you know what, contact this person, contact the doctor. She has information that you might see, you might be not aware of, that will help you towards your own goals and your own
Certainly.
desires of helping others. So
Mhm.
that's what this is all about. And I'm so very, very thankful that you brought that information up, because I am indeed putting it in my resource
Thank
catalog
you.
where I could send people to that ask me, because I have it happen so often where I'm asked, and I send them locally, not realizing that this your Fides is a part of a global network. So
Yeah.
I thank you for that. Thank you for sharing that information.
Thank you. Thank you. Always a pleasure to be here. And please, I do want to say that, please share this with somebody who you think would benefit. Again, this is not just a one person show. It's not just about me or you. It's our community. And in order to empower our community and be more productive, be more beneficial to one another, to reap the better, like a more global benefit for not just us, not just our generation, but the generations to come. We have to live a healthier life. We have to do better. We have to be better. And how can we achieve that? How can we accomplish that without knowledge? It's
Well,
knowledge
it,
is power.
it is, and this is the thing. How can we do that with us having knowledge and not sharing it? With us
Right,
having
right,
having the
right.
knowledge and not collaborating with others and sharing this information with others so that they can have it.
Certainly.
I be as smart as I want to be, or as into whatever it is I'm into. But if I
Mhm.
don't have the power behind me, and I'm not sharing the information, and I'm
Yeah.
not collaborating, when I'm doing is competing instead of collaborating, that
Mhm.
helps no one.
Yeah,
So as she
I agree.
stated, please share this information. Once again, the videos that we've done are free. I can send you
Mhm.
download it, send you the link so that you can share with your people that follow you or in your community that you might feel as though this will be beneficial to. I will be able to do that. I would love to do that because me holding on to the information on my website, that's helping the people that look at my website. But what if you don't look at my website? What if you're like, well, I don't really want to do all of that? Ask, ask, and it
Yeah,
shall be given to you. I will most
absolutely.
gratefully share this with you. Dr. Kafilat, what I do want you to do is, with that beautiful smile of yours,
Thank
can
you.
you give us 2 to 3 tips that you want us to walk away from this conversation with today?
Mm. Always keep in mind that you are your own advocate. No one will advocate for you or take care of you better than you will if you are serious about your health. Health is wealth. It doesn't matter how much you have to work. If you don't have health, you can't have wealth. And number three, always remember that even though it's our body, it's not necessarily ours. It's a temple. Take care of it so it can take care of you. Whatever you do to it, it's gonna pay back double. So if you take care of your body, you are going to reap the benefit in a much, much bigger way. So keep those in mind.
And
And
with
thank
this,
you for listening.
yeah, I certainly do. I appreciate everyone that has bothered, that has taken the time to actually listen today, as well as listen to the many other recordings that we've actually brought forward to the people. Because, as I say all the time, if you don't know, you're lost, right? You can't get
Mhm.
engaged and empowered in your own healthcare if you simply don't know. Stop
Certainly.
waiting or stop pointing fingers and placing
Hmm.
blame, and listen and get to stuff that you need to have done, get it done.
Yeah, you
Um,
have to take charge.
yeah. So with that being said, I am going to go ahead and close out for the day. Continue to have a beautiful day.
Thank you. You too. Bye. Bye, everybody.